doing my hand hygiene, providing privacy for my patient. My name is Raven. I'll be your nurse for today.
Hi, Raven.
Could you state your name and your date of birth for me?
Sonia Toots, November 3rd, 1975.
All right, can I just clarify what your wristband? Great, Ms. Toots. All right, Ms. Toots, so the doctor has put a head-to-toe assessment for you. We're just going to do your respiratory, your cardio, musculoskeletal, your GI, your genitourinary, your HEENT, neurological, and we're just going to get that all assessed and see how everything is, okay? All right, so Ms. Toots, so we're just going to start off with just some basic safety skills here at the hospital. So first, I just want to make sure that you always have socks on or shoes, just to make sure whenever you're moving around, we don't want you to slip and fall.
Okay.
We want to make sure that your bed is in its lowest position and the bed is locked with it having wheels. That you have your arm rails up as well. And also, Ms. Toots, we want you to have your call light.
Okay.
You press this button anytime that you need assistance with anything or any questions or concerns.
Okay.
And then we want to make sure that you always have your wristband on. That's a patient identifier. So when we give passing meds to you or we get vital signs, we're able to scan, make sure that you're Ms. Toots.
Okay.
All right. I believe I went over everything, Ms. Toots, with the safety skills here at the hospital. Okay, now we're just going to start with your cardio assessment, okay? All right, so we're just going to check for jugular vein distension, Ms. Toots. I just would like for you to, I'm going to let your bed back at semi-phalanx position, and I just want you to turn your head over. I want to make sure I'm just inspecting. All right, and then I want you to turn again. Great, I don't see any distension in your jugular veins, Ms. Toots.
Okay.
Great. All right, so we're just going to move your call light over.
Okay.
So I want you to stick your arms out from Ms. Toots, and now I'm just checking for edema, okay? I'm just doing this little muscle. Checking for any swelling. I'm going to do your lower extremities as well. Wonderful. No swelling, okay?
Okay.
All right. And now I want to do a capillary, what we call a capillary refill. I'm just going to hold in your fingertips 2 to 3 seconds just to see your blood refill on your fingers, okay? Wonderful, great refill time, Ms. Toots. All right, so now we're going to move over to palpating your radial pulses, Ms. Toots. I just want to make sure that I feel both of them at the same time, and then I'm going to rate them on a scale of how bounding your pulse is. Okay, that's a 2+. And then I'm going to do your dorsalis pedis. That's a 2+ as well. And now I'm going to do your posterior tibia. Great, that's a 2+ as well, Ms. Toots. All right, so now I'm just going to go over a few more pulse areas that we can check, which would be your popliteal in the back of your knee, your femoral in your groin area, your brachial in your arms, your axillary underneath your arms, and then your carotid on each side of your neck.
Okay.
All right, so now I'm just going to listen to your heart sounds, Ms. Toots, or escalate your heart sounds. I'll use the diaphragm side first, and then I'll use my bell side to check for movements, okay? And I verbalize that I'm doing, my stethoscope is in contact with my patient's skin. I'm doing your aortic, your pulmonic, your herbs. Can you lift your breast from Ms. Toots? Your tricuspid, and your mitral. And we're going to do the same thing for the bell side, check it from murmurs.
Okay.
Your aortic, your pulmonic, your herbs. Can you lift your breast from here? Your tricuspid, and your mitral. All right, great job, Ms. Toots. Your heart sounds great. So now we're gonna move over to your respiratory sounds, okay? Be your respiratory assessment, okay?
Okay.
Alright. And also, Miss Susan, are you having any chest pain or shortness of breath?
No.
No? Wonderful. Okay. So for your respiratory, I'm gonna ask you like your breath sounds. And I want you to just take some deep breaths while I check each of your lobes.
Okay.
So I'm gonna start off with your right upper lobe. Great job. Left upper lobe. Okay. Left lower lobe. Right lower lobe. Great job. So now I'm just going to check the lateral side of your respiratory.
Okay.
So I want you to just cross one of your arms over. Alright, deep breaths. Great job. I'm going to check the other side. Deep breaths. Great job. Your lobes sound clear. That was your your anterior side, Miss
Okay.
T. So now I'm going to check your posterior. So I just want you to sit up and you can just cross your arms in front of you. Okay. Alright, your left upper lobe, deep breaths, please. Alright, your right upper lobe. Alright, your right lower lobe. And your left lower lobe. Alright, your breath sounds very clear to me, Miss Toots, okay? Alright, Miss Toots, so now we're just, I'm also just going to do your respiratory rate.
Okay.
I'm just going to count your breathing and just check for shallowness of
Okay.
your breathing, okay?
Okay.
I'm just okay if I put my,
Sure.
place my hand here, thank you. Alright, great job, Miss Toots. I got 16 for your respiration rate, and your respirations are regular, they're not shallow, okay? So now we're going to move over to I want to educate you on 2 exercises to help with loosening mucus in your lungs.
Okay.
So first we have turn, cough, and deep breathe. You can, when you're laying in the bed, you can just turn, take a deep breath in, and cough. And then, would you just let me do that for me, Miss Toots? Turn. Good job. You can just do it on each side every 2 hours, okay? Another exercise would be using the cerebral barometer. You would inhale, hold it for 2 to 5 seconds, and exhale. And could you do that for me as well? Great job. And this you could do every 10 times in 1 hour. It's just during commercial break, it's probably like the best time to do. And this just helps with not having, being able to have pneumonia
Okay.
in your lungs, okay? Alright, Ms. Toots, so now we're going to move over to your HEENT and neurological assessment.
Okay.
So right now, I just want to ask a few questions. Thank you. Alright, have you had any head injuries, Ms. Toots?
No.
Okay. So now I'm just going to inspect your head area, make sure that everything is symmetrical and nothing's off, okay?
Okay.
Alright, everything looks good, skin tone is even, everything is symmetrical. Alright, so now we're going to move over to the hearing. Do you have any difficulty hearing?
No.
Alright, so we're going to do a whisper test, Ms. Toots. So I want to stand arms lift away from you, and I'm going to whisper a number and letter combination of, okay?
Okay. C56.
Yes, great job, Ms. Toots. Alright, and now we're going to move over to your eyes. I'm going to use my light pen to do your pupillary response.
Okay.
And then I'm just going to size your pupil as well, okay? Do you wear any glasses or contacts?
No.
No. Alright, and I just want you to look straight at me, Miss Toots, while I come across with this light. Alright, I'm going to come across one time. What I was looking for there, Miss Dukes, was just making sure your eyes are constricting at the same time. And then I want you to follow my light pen as I bring it in, okay? Alright, great job, Miss Dukes. Okay, so now we're gonna do your nose. So we're gonna do a test called the nostril patency test, where you hold one side of your nostril, take a sniff in, and then do the same to the other side. Okay, take a sniff in. Great. And Miss Dukes, do you have any nasal congestion or runny nose?
No.
Or nasal discharge? Wonderful. And then now we're just gonna do your mouth, throat, and neck. So I'm just gonna check the inside of your mouth. I want you to open up and say ah for me. Wonderful. And I'm just checking for a pink, moist, and no decay in your mouth. And also, Miss Dukes, I'm just gonna check your trachea and midline. Now, are you having any difficulty swallowing?
No.
Wonderful. So, Miss Dukes, could you please tell me your name again? Say your name and date of birth for me.
Sonda Toots, November 3rd, 1975.
And where are you right now, Miss Dukes?
At the hospital.
Do you know what year it is?
2024.
And who's the president?
Joe Biden.
Alright, Miss Dukes, so that was just a test to assess your level of consciousness, make sure that you're here at today's time.
Okay.
Also, I want to go over the Glasgow-Coma. This is a level of consciousness test that we do for if you have a brain injury. And we're just looking for eye, motor, and verbal response.
Okay.
Alright, that assessment is done again. So we're just going to move over to your GI now, Miss Dukes.
Okay.
So I'm going to just look at your stomach and check for symmetry, even skin tone, and just make sure it's flat.
Okay.
And I'm just going to keep it short right
Okay.
here. Wonderful. So now I'm going to aspirate your bowel sounds, Miss Dukes.
Okay.
I'm going to start here in your your right lower quadrant. And move up to your right upper quadrant. Move over to your left upper quadrant. Left lower quadrant. And then verbalizing that my stethoscope was in contact with my patient's skin. Alright, so now we're going to listen to, on the bell side of it, we're going to listen to your aortic valve, your renal valve, and your iliac.
Okay.
That was your aortic valve. Listen to your renal valves now. And now we're going to listen to your iliac valves. Alright, wonderful. Let's take spinal sounds. How we doing, okay?
Okay.
Alright, so now I'm gonna lightly palpitate all of your quadrants that I just checked over. So we're gonna start here in your right lower quadrant.
Okay.
And just feeling for any like hardening or distension.
Okay.
And also when checking for your patient's, palpating your patient or aspirating your patient's bowel sounds, we just want to make sure patient is in a supine position. It's best, easier to hear those ways, okay? Alright. Alright, what was your last bowel movement, Ms. Dukes?
This morning.
This one was great. And have you been passing gas?
No.
No? You sure? Okay. Alright. Do you have any abdominal pain?
No.
Okay, so now this is where we move to your musculoskeletal. This is just checking for your range of motion. I'm just going to show you a few different types of range of motion, okay? So if you hold your arm out straight, this is what we call extension. And if you curl hold your arm like you're flexing. Yes, perfect. This is what we call flex line, okay? And if you bring your arm all the way back to where you can't go anymore, this is hyperextension of range of motion, okay? In your arm. And I also want to show you in your leg as well. So if you bend your knee, that is flex line. Straighten out your knee, that is extension. And then bring your leg all the way back, that is hyperextension.
Okay.
It's going to the leg that you can't go anymore.
Okay.
Alright, so we're just going to do a strength test on both of those
Okay.
separately. So we'll do one on your upper extremity, which is your arm. So I want you to bend your wrist, and I want you to push against me. Great. And I want you to flatten it back out, and then push against me again. Great. So I'm going to place my hand here, I want you to push down on me. Great job. I'm going to place it above, I want you to push up. Great. So we're going to do the same thing with your leg and your ankle, okay? So bend your knee down, leave your ankle down, sorry. Right. Flex your foot for me. Push against me. Great. Your leg, push down on my hand. Great job. Push up against my hand. Great job. Let's do. Strength levels are great.
Thank you.
Alright, and Stu, have you had any difficulty dressing yourself? Do you need assistance dressing yourself?
No.
Anything? Great. Alright. And are you having any difficulty urinating?
No.
No? Alright, so we have your full head to toe assessment done. I'm going to document this and get over to your doctor. Do you have any questions or concerns?
No, no question.
Alright, thank you so much, Ms. Susie. Have a good day, okay?
Thank you.
Alright, doing my hand hygiene, provide privacy for my patient.